Doctors and healthcare workers at Delhi's Hindu Rao Hospital and NDMC Medical College are threatening to withdraw their services within 48 hours in protest over non-payment of salaries. Doctors say salaries have not been paid for 3.5 months and that they are struggling for even basic needs. They're saying that it's extremely disheartening for corona warriors to be working without their salaries. Akshay joining us with the latest on that. Akshay, this is obviously going to affect both patients as well as the work of these hospitals. But presumably for doctors, frontline workers, it's also impossible to carry on. Why has this been continuing for so long?
हमें हमारा वेतन दो are the slogans that are being raised by all the doctors that have gathered here. Now we must remember that these are the corona warriors. These are the same people the government asked to respect. The government showered flower petals on these very doctors and healthcare workers. The Prime Minister himself asked people to bang thalis and clap for these very people to honor their services. These people are risking their lives every day, not only their own lives but the lives of their family members whenever they treat COVID patients and are possibly carrying the virus as well while doing their jobs. So under these very difficult circumstances, the hospital authorities here at the Hindu Rao Hospital has not paid salaries for the past 4 months for these very doctors and nurses who are present here. A small delegation just a while back went to the Lieutenant Governor and they have presented a memorandum that the most important thing here is that these doctors have threatened to withdraw their COVID services if their salaries are not paid within 48 hours. So past 4 months the salaries were not paid. We have with us Dr. Abhimanyu and Dr. Sagar who are RDA representatives here. Dr. Abhimanyu, for how long have you been protesting for your own salary, for your own right?
We've been protesting for past 15 days, almost. It's going to be 15 days on this Monday, this coming Monday it will be 15 days. Because earlier we were doing a symbolic pen down protest from every day from 9 to 12. And in which we were maintaining the decorum and completely following all the guidelines. And we were just in our departments but not doing any pen work. And since this Monday now we are on a 9 to 12 symbolic protest that we were following till now. But today we planned for a march till the LG office. But as you can see, there are police forces and barricading done just to prevent us.
We were not given the permission.
So these people, the representatives of RDA were planning a march to the residence of the Lieutenant Governor. But as you can see, a lot of police deployment has been done by the authorities. So this hospital comes under the North Municipal Corporation and they have not paid salaries. The only reason that has been given by the authorities is that they do not have enough funds to pay the salaries of these very people. And not only the doctors but the nurses are also facing the same issues. Even paying their EMIs and getting a loan has become very, very difficult. Ma'am, what exactly are the problems that you have been facing for the past 4 months and what are the difficulties that you are facing now?
Now we are on the end, receiving end now, and we are not paid our 4 months salary, and it is very difficult to survive without money. We are dependent on only this salary, which is not given to us since 4 months, since June. Now what can we do? The employee can only protest.
So you were telling me हर बार जब ऐसा होता है आप लोगों को प्रोटेस्ट करना पड़ता है अपनी सैलरी के लिए, उससे पहले मिलती नहीं है तो
बिल्कुल मुझे ये आज तक समझ नहीं आया कि हम लोग सो कॉल्ड कोरोना वॉरियर्स और एमसीडी एम्प्लॉयज़ है, गवर्नमेंट एम्प्लॉयज़ है, लेकिन हमें अपनी सैलरी के लिए बार बार बोलना क्यों पड़ता है कि हमें सैलरी दीजिए, जब इन्होंने हमें काम के लिए नहीं बोलना पड़ता कि आप काम कीजिए, तो हमें ये बार बार क्यों बोलना पड़ता है कि हमारी सैलरी हमें दे दो.
So this is nurse. I'll also speak to some other lady that is present here. मैम आपको क्या क्या प्रॉब्लम्स है? EMI हो गए, लोन हो गए, बच्चों की फीस हो गई.
मेरा बेटा इस टाइम MBBS कर रहा है बाहर, उसकी फीस जाती है इतनी. अब ये टाइम आ गया कि हमें दूसरों से लोन लेके और दूसरों से क्रेडिट लेके हमें भेजना पड़ रहा है, क्योंकि बाहर जो बच्चा पढ़ रहा है उसको तो आपको खर्चा भेजना ही भेजना है, और वो खर्चा किससे मांगेगा, क्योंकि हस्बैंड की भी इस टाइम पे सब लोगों की प्राइवेट जॉब वालों की जॉब भी चली गई है और मेरी भी सैलरी नहीं आ रही है, तो कितना मुश्किल है. बाहर जो बच्चा भेजा हुआ है उस बच्चे को तो पैसा देना ही देना है ना हमें, तो हमें इतनी परेशानी हो रही है.
So these are the situations. These doctors are forced to come out of their hospital. They are saying that it is their dharma and it is their job to provide services to the COVID patients. Let me remind all of our viewers that Hindurao Hospital is an exclusive COVID hospital. Now what we are hearing is that the mayor of the NDMC might be visiting, but all of these promises have been made time and again to these doctors and healthcare workers, but nothing concrete as far as policies are concerned has been done, and that exactly is the reason that these people are forced to come out every now and then just for their own rights for providing services to the entire country.